They decided we'll triage. We will give each patient a number which will indicate their evacuation priority. The ones are going to be people who are walking and talking, who we can easily get out on a boat, or they're ambulatory. The number twos are somewhat sicker people, maybe in wheelchairs. They might need to go out by helicopters. And the threes are going to be, as they decided ultimately, the last priority for going out. Once things got very bad, they decided that we're going to save the sickest for last. So these were either very sick people or people, if a nurse opened up a chart and saw do not resuscitate, DNR, those were made number threes. When I spoke with them, very different views on why they participated. So some will tell you that this was purely comfort care, and that they were doing this because they felt that these people were suffering. And then there were other people who said, you know what, we set out to hasten these people's deaths, and there were different reasons for why that was done. One physician, for example, pointed out that the health workers, including himself, many of them felt very at risk being in that hospital, that there was a lot of danger, a lot of fear that the people from the neighborhood would overrun the hospital. There were others who just felt that this was the right thing to do, with people very little time left to live, and it was sort of easing them into a death that they would be meeting in any case. So there were all sorts of reasons why people participated in giving these drugs. I spoke with many medical ethicists and experts in end-of-life care to try to sort of look at these issues and understand them for myself, because I'm not practicing in this field. And one of the very interesting things, a person who's part of the AMA, the American Medical Association's Council for Ethics and Judicial Affairs, said to me that it's very hard for medical professionals to look at people and see them suffering, or see them languishing, see them looking so bad, that at some point perhaps that patient isn't conscious of it anymore, but we as health workers, or as people who love those people, family members, it may be much harder for us to see somebody who's really not suffering but looks terrible, and for health workers to be put in a situation where they can't offer those people what they would want. And he said something very interesting, which is, this is why we have prohibitions on euthanasia, because we need these rules for us to follow in cases where we face this, where our instinct is to put that person out of their suffering. So I thought that was quite an interesting point. Imagine this happens on, a storm hits early Monday, Tuesday, everything goes down, and now you're Thursday. And you've been carrying patients, no elevators working, carrying them downstairs, everybody's sweating. Patients are separated from their nurses, their nursing units, the medical care that they usually give. Medical care has gone down to fanning people with some cardboard, giving sips of water for people who can drink, and the incredible exhaustion. One of the characters, Dr. Poe, who's the main character, she's a surgeon. She's done overnights. She does incredibly long surgeries, and she said she can't remember a time in her life where she slept less.